Hello, everyone. Thanks for coming today to the McMaster Health Forum here at McMaster University in Hamilton, Ontario. Those who are joining us in the room, those who are joining us online for our latest Queen Elizabeth Scholarship webinars. A quick little summary of what we're going to accomplish today. I'm going to give you a quick little overview of the forum and our scholarship program, and then I'm going to turn it over to our scholar presenters who will talk about their experiences as QE scholars. The McMaster Health Forum is a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders to act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program is a unique partnership between Universities Canada, the Rita Hall Foundation, and Community Foundations of Canada, as well as the individual Canadian universities that are involved. It is made possible by financial support from the Canadian government, provincial governments, and the private sector. The purpose of the program is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. Here at the forum, the QES program has existed twice. There's been two different programs. The original program was on strengthening health systems and involved only Commonwealth countries. The second program, of which we are 20 Canadian institutions to be awarded a second QES program, is on strengthening health and social systems, and the scope expanded beyond the Commonwealth to include low and middle income countries. Our scholars contribute to strengthening health and social systems and become part of our large and growing network of health and social systems leaders. Our original program had a number of scholars involved. Here's a list of the 14 incoming scholars, so international students who came to McMaster, and 3 outgoing scholars, and a large list of 44 outgoing interns who went and worked with our partners abroad. Our current program on strengthening health and social systems has so far engaged 7 incoming scholars and 13 outgoing interns who you will hear from today. In the photo there are some of our scholars, one of whom will be presenting today, along with the former Governor General of Canada and the current Lieutenant Governor of Ontario. Our presenter today is Saif. Saif was an undergraduate student in the Honors Integrated Science Program at McMaster University. He was also a foreign fellow, and during his fellowship, Saif played an integral role in the synthesis of rapid evidence profiles and living evidence profiles, which were used to help inform and support decision makers during the COVID-19 pandemic. Through his internship, Saif hoped to further develop his health policy and public health knowledge and gain a better understanding of healthcare systems in terms of governance arrangements, management, and delivery of health and social services. Saif, over to you.
Perfect. Thank you, James, so much for the lovely introduction, and good afternoon, everyone. Today, I'll be talking about my QES experience at the New South Wales Ministry of Health, also branded as NSW Health. And specifically here, I was in the Population Health Training Unit based in the Evidence and Evaluation Unit within the broader umbrella of the Center for Epidemiology and Evidence. And so today, during my presentation, I thought I'd split it up into 3 different sections. The first is just a background about New South Wales Health, as well as the center that I was working at. The second part of the presentation will be involving my actual contributions to the Ministry of Health in terms of 3 different areas that I focused on. So the first was working with the Population Health Training Unit team. The second was the Strategic Research and Evaluation team. And finally, some broader Center for Epidemiology and Evidence initiatives that I also helped around with over the course of my internship. And finally, I thought I'd end it off on a nice note in terms of some of the explorations and adventures that I did. I thought I'd break this up into 2 parts. The first was New South Wales and Sydney, and the second was stuff that I did in Queensland, which is one of the states just north of New South Wales. And finally, some key takeaways and some practical tips for anyone who's wishing to visit Australia or Sydney within the next few years or any time like that. So in terms of New South Wales Health, this actually governs the largest public health system in Australia, and it supports the cluster and portfolio ministers that are elected through the government. One of the main objectives is to guide the development of services and investment in the public health system to ensure health priorities are achieved. And in terms of the actual governing body, it's responsible for 8 metropolitan local health districts, also noted as LHDs, as well as 7 rural local health districts, 2 specialist networks, and 1 affiliated health organization. So within the actual Center of Epidemiology and Evidence that I was working with, this is directly reporting to the Chief Health Officer, who at this point was Dr. Carrie Chant. And so the 5 key areas that this center focuses on is the first is monitoring and reporting quality information on the health of the population. The second is delivering statewide record linkage services. The third and the fourth are some of the actual objectives that I kind of focused on as well during my internship. So the third was developing the population health workforce through workforce training programs. This included some of the biostatistic training programs, as well as the Aboriginal health population health training program as well. The fourth was strengthening the evidence base by conducting evaluations and translating evidence and information into policy and practice. And finally, the fifth was developing and maintaining key population health infrastructure. So the first project that I wanted to discuss here was a project regarding internships and how the Clean Connect system can be used to manage public health placements across the New South Wales Health kind of government and Ministry of Health there. So kind of some background about the Clean Connect system. It's actually an interface that connects service providers such as hospitals or other clinics to education providers. So this can be universities or actual professional schools. So typically what we've seen is that nursing programs, medical schools, as well as other allied health professional schools have used the Clean Connect system to actually manage their clinical rotations. And this is something that we wanted to see integrated within the population and public health network as well. And this was something that is available on Clean Connect, but it's not being optimized to its best capacity, especially within New South Wales. And so one of the first things that I was tasked with was to actually further understand this system itself. And so I had to review the Clean Connect training modules and fully understand and get a good grasp of what it contained and what it entailed. Then I also made a process map that highlighted the different steps involved in recruiting practicum students. And then the actual big output from this was to actually hold a key stakeholder interview with the Clean Connect manager, as well as 2 local health district coordinators as well, and see what is the actual current state of Clean Connect and the public health landscape or the sphere there, and how many people are actually utilizing it and how can we improve. So some of the things that we heard from this actual discussion here was that there's a lack of clear communication between education providers and health service users. So oftentimes there's postings or there's listings for public health placements, but the students who are going to these education providers and the coordinators don't actually know how to actually undertake that internship itself. And so what we found was we needed an actual central point of contact in the universities to help with the systematization of the processes itself and ensure that there's a consistency across the system. So in terms of some of the key learnings and the impact of this project, so by the end of the stakeholder interview that we had and the outputs that we put together, I found that there's a very clear cut importance for having directives and systematizing processes to ensure that there's consistency across the system itself, and to ensure everyone knows their responsibilities and that people are able to optimize and utilize the services that are provided. And so the impact of this project was the preliminary consultations that we had will be used to streamline the recruitment process and facilitate the onboarding of students that are interested in undertaking public health internships at New South Wales Health in the future. The second project that I worked on was helping to develop a revised New South Wales population health research strategy. So this was part of the strategic research and evaluation team. And my responsibilities here were very similar into the actual work that I was doing at the McMaster Health Forum over the course of my research assistant tenure, as well as my forum fellowship. And so I was responsible for conducting national and international environmental or jurisdictional scans. And so we looked at 4 different countries that had comparable health systems. So we looked across New Zealand, Canada, the United Kingdom, as well as pan-Australian wide as well, so across the different states in Australia. And so together we looked at 11 different provinces or states. And from my actual searches, I found that there was 39 documents that I found were relevant to actually further analyze and scan. And upon doing an initial scan of the 39 documents, it found that there was 16 that I could move forward and actually do a full text analysis upon and prepare a summary of findings that I once put together in a summary document and gave to my supervisor that we can further use for the revised strategy that's hoping to come out sometime next year. And so some of the key learnings from this actual project entailed the importance of learning from comparable jurisdiction and ensuring consistency and alignment of values within a country itself. So as this is a population health research strategy in New South Wales, it's important that we ensure that there's consistency across New South Wales, Queensland, as well as Victoria and all these other states as well, to ensure that the overall goals and objectives of these specific state governments align with each other, and we're working towards the promotion and well-being of the population and community itself. And so some of the impacts of this actual project will be that this information that was collected will be used to guide the development of the revised population health research strategy. The next is something that kind of helps inform the research strategy as well, but it's also standalone output as well. So this is a rapid review focused on evaluation capacity building. So evaluation capacity building is essentially learning how to use evaluations to essentially using evaluations and conducting evaluations to use those results into actual research capacity and decision making. So in terms of some of the responsibilities that I had here, this was kind of more on the research side of things. So I assisted in developing a research protocol that was then uploaded to Prospero. I then conducted different searches in scholarly databases such as Ovid, EBSCO, and then Google Scholar as well, alongside some great literature and some jurisdictional scans as well. So then together as a team, I worked with a few other colleagues of mine to help title and abstract some articles that we had found using Covidence, which is one of the new systematic review screening softwares that I became familiar with. And so we found about 1,447 documents that we identified. From that, there was about 142 duplicates across the different databases that we searched. And from there, we had about 1,305 title and abstracts that we had screened. And from there, upon screening all of those, we then dwindled it down to about 88 for the full text. So we're at that stage now where we're doing a full text review to see which actual articles are going to be included within the final rapid review there. So some of the key learnings from this was that it actually helped to enhance my research skills, and I gained familiarity with some new systematic review screening softwares such as Covidence as well. So this is something that I think in my research career now I can take forward. And if I was ever to do a systematic review or a rapid review in the future, this is definitely a systematic screening software that I would use and implement as well. So some of the impacts from this would be that it would help to inform the development of the revised New South Wales strategy, as well as add value to the current evidence base regarding evaluation capacity building in the literature. And one thing in specific that we're noting here is to see if there's any changes in the past 2 or 3 years, given the COVID-19 pandemic, and how there could be online evaluation capacity building efforts as well. So the final project that I wanted to highlight in this presentation here was a broader public health response debrief. And this was quite a large project that the actual Ministry of Health and the Center for Epidemiology Evidence were working towards, as this was looking and capturing a breadth of viewpoints and experiences of the actual health response during the pandemic itself. So I did serve a small role here in terms of supporting the debrief team with conducting key informant interviews. And so I was involved in conducting these stakeholder interviews with a wide range of different staff members at New South Wales Health, including many senior medical advisors that directly were in contact with the chief health officer as well during this time, alongside other staff members as well. So I was also responsible for reviewing and managing the interview transcripts and taking down notes to ensure that we can use that in the actual final output itself. I also attended a debrief workshop on infrastructure or IT systems, infrastructure and surge planning, alongside attending weekly meetings with the synthesis team and our consulting group, which was KPMG. So some of the key learnings here was the importance of stakeholder engagement to capture a breadth of viewpoints and experiences, especially given how vast the COVID-19 pandemic affected different individuals, different ministries, different departments within Australia itself. And so a lot of the information that I heard, I thought was actually comparable to what was going on in Canada as well. So this was a neat experience to see how there were differences, but similarities as well in terms of different pandemic responses. So the impact of this will be that the actual report, alongside the compendium of resources that we're going to be making, will help highlight some key learnings and recommendations to improving future public health pandemic responses in the future. So moving on into some of the explorations of my time in Australia. So as soon as I had landed in June, I was lucky enough to actually make it for the Vivid Lights Festival. And this was one of the largest light festivals in the entire world. And so they had the entire greater Sydney area with lights and different light projections. And so I did a boat tour across the harbor just to see the actual Sydney harbor landscape and the skyline there. So it was one of the most beautiful things I had seen up to this time. I also visited the iconic Bondi Beach, as well as one of the local zoos there. It's called Taronga Zoo. I was also able to watch an Australia versus a rugby union game. I was able to go out into the Tasman Sea and do some whale watching, where I actually saw two humpback whales doing a breach there. And then finally, I also did a Bondi to Coogee coastal walk. So this was about several kilometers in length, where I visited a number of beaches over the course of this coastal walk. And it was one of the most lovely sights to view. So kind of moving on into my second set of adventures here, I took a few flights into Byron Bay, the Gold Coast, and Brisbane. So these are some of the adventures that I had in Queensland. I was also able to visit the Australia Zoo, also known as the Steve Irwin Zoo. And this was one of the largest zoos I'd ever been to. I also made a trip up to Cairns and Port Douglas, as well as the Great Barrier Reef and the Daintree Rainforest. So the Daintree Rainforest is actually known to be one of the oldest rainforests in the world. In the Great Barrier Reef, I was able to do a helmet dive that you can see. I'm actually pictured right beside a fish that they had brought, and they kind of circled around. And so we kind of lined it up with myself, and then we took a picture there. I was able to do a city to surf run, which is about a 14-kilometer run from the greater downtown Sydney area up until Bondi Beach. I was also able to book a surfing lesson, and I learned how to surf. I won't say I was amazing at surfing, but it was quite the experience there, and I definitely would recommend it. And then in Byron Bay, I was also able to do a horseback riding lesson that led from the forest onto the beach over there as well. And that was a surreal experience as well. And so some key takeaways or practical tips, especially traveling abroad. For instance, for myself, I was also traveling alone and living alone as well. So I thought one of the key takeaways I would say when you're traveling abroad is to step out of your comfort zone and don't fear spending time alone. I think by spending time alone, you're able to discover a lot about yourself and put yourself into different experiences or different situations that you wouldn't have otherwise put yourself in if you're living at home with your friends, or you have some company that are around you. And so, for instance, there were a number of different social gatherings that I put myself out there and I attended. So I went to some charity events. I found a lot of different friends at the local gym. With those friends there, we ran that 14-kilometer run. So just seeing the diversity of people and the different common interests that you may have with a lot of different people in different parts of the world is something that you can bond over, and I was able to do that, and I would definitely recommend that. I guess something else I would say would be to embrace the culture and the local language, especially with internships that span a few months. I would say you're not a tourist anymore. You're kind of integrating yourself within the actual community and the culture itself. So to kind of make the most of that, I would say fully embrace that head on and kind of integrate yourself in the culture as best as you can. Some of the practical tips I would say is everything in Australia is on the opposite side of Canada. So I often found myself walking on the opposite side, looking when I was crossing the road in the wrong direction. So I would say there's quite a few times where people pointed me to stay on the left-hand side. And so it took me about a few weeks to actually get my brain to process that and get adjusted into staying on the left-hand side. But I'd say that's something that's quite important if you're going to that part of the world. Something else I didn't know until I actually landed there was how massive Australia was. And so I thought I could do a quick road trip from Sydney to Melbourne, but little did I know that would take me around 11 or 12 hours to do. So the key thing I would say, especially in Australia, is given that everyone lives around the coast, short flights are probably the best way to navigate yourself across the country. You can do quick 45 minute 1 hour flights, or even like a 3 hour flight to get up to Cairns. And those are probably the best way to travel across Australia. I will say there's a lot of nice coastal drives and scenic views along the way as well if you were to drive. So that's something that I would definitely recommend as well. One thing in terms of your living and housing arrangements that I would say is important is when you look at the rent prices, just know that they're listed per week and not per month. Here you're paying per month and you're going to be noticing a dollar amount, whereas over there it's a rent amount that's listed per week. So you just have to kind of be mindful of that. And the other thing I will say is the hours of operation for shopping centers. So I do come from Mississauga, the Greater Toronto area, so the GTA. So a lot of the shopping centers here open and stay open late. That's something that I thought was quite different in Australia and in Sydney in specific, as they would close during working hours. So around 5-6 o'clock p.m., the shopping centers would be closed, except for Thursdays where things stay open a bit later. And then you have until about 9 p.m. to do some shopping there. So that would be some of the practical tips that I would give someone who would be visiting Australia. And so finally, I'd just like to acknowledge the partners and the sponsors who are able to help this Queen Elizabeth Scholarship Program take place and help me get to Australia there. So I'd just first like to thank the New South Wales Ministry of Health for inviting me and allowing me to be a part of their team and working with them. I'd then like to thank the Queen Elizabeth Scholarship Program in specific Universities Canada, the Rita Hall Foundation, and Community Foundations of Canada, who are able to help fund the scholarship opportunity, as well as the McMaster Health Forum and the McMaster University, who are able to help provide me the opportunity to go abroad and be granted this scholarship opportunity. And last but not least, I'd like to thank my supervisor, Mr. James McKinley, for the opportunity to go abroad. And thank you so much for taking your time to listen to this presentation. And if you have any questions, please feel free to let me know.